And there we go. Let me hit that button. Good. All right. So what I really wanted to get into today is who needs chiropractic care? Who needs upper cervical care more specifically? And with that in mind, the real easy short answer is, in my opinion, everybody. Everybody's got a spine. Everybody's endured trauma. Everybody's had different challenges throughout their life. And really, what it boils down to is making sure that you have this I'll say optimal connection between between the brain and ultimately the rest of your body. So with that said, as human beings, and even frankly most animals, we have spines. We have opportunities to create these misalignments and change the circumstance within our body so that it's not working as well as or as efficiently as it possibly could. So again, the short answer for who needs upper cervical care is pretty much everybody. Now, again, as I mentioned before, I'm biased, but um, I can't think of a single person who hasn't experienced some form of physical, biochemical, even psychological trauma where it wouldn't have an impact on the nervous system. So I feel as though it is substantiated to minimally check and see if that's affecting somebody's overall health and wellness. Um, but there's a ton of people who currently have symptoms or conditions or pain associated with misalignments. And I will also say again in the most biased of context, as I'd been a patient for a long time prior to getting into chiropractic, that that I've benefited so much from the different approaches that I've used with my patients here that it's hard for me not to be biased. So with that in mind, there are lots of other approaches to healthcare, nutritional supplements, exercise, making sure we're sleeping and resting the proper amount, meditation, acupuncture, etc. But the thing that I always come back to is knowing the anatomy of the body and understanding that the brain stem is very much integral to allowing for, or I should say, maybe acting as the conduit, the information superhighway, if you will, between the brain and all of the parts and pieces of the body, and literally on a cellular level, allowing for things to perform the way that they're supposed to. So the brain has all of this innate intelligence, as I like to call it, within it that allows us to function properly based on the myriad of different circumstances that we run into throughout every moment of every day. And yet our bodies and brains know how to do it. They know how to not digest food when you don't have food in your stomach, and knows how to digest food when you do have food in your stomach, to fight off infections as they become present, but not really get overzealous when there isn't an infection present. Making sure our heartbeat at rest is 50, 60, 70 beats a minute, but that it goes up as soon as we start to exercise or even go up a flight of stairs. All of these things are innate within us, but they can be interfered with, and that communication can be altered simply because of a misalignment within the spine, primarily in the uppermost part of the neck. So, again, who would benefit from upper cervical chiropractic? Pretty much anybody. The idea, I'll say not the idea, the um, orientation that I take is, let's check, make sure that a misalignment is present, and at that point we can look at, all right, great, what does it take to reduce or eliminate that misalignment, or do we have to, what do I want to say, or do we have to manage it in the context of, geez, it's been there for a while. We're going to get a certain amount of correction involved. We're going to see a reduction or elimination of symptomatology, we hope. But do we have to kind of keep up with it going forward from there? So that's kind of the who needs upper cervical assessment or chiropractic care. And the why, like I said, you can't live without a brain stem, and you don't want to be monkeying with that too much. And it's in the ability for it to act as that conduit between your brain and all the different systems of the body. So the why portion is pretty significant in the context of I guess I'll say the span of which one can benefit from upper cervical care, because I've had patients with everything from difficulty with asthmatic type symptoms straight through to, of course, back pain and neck pain and that sort of thing, and sciatica, for example. But there's so many other circumstances, dizziness and headaches and digestive disorders, et cetera, that aren't that oftentimes, again, in my opinion, may not be being treated or addressed as I don't know, easily, efficiently, properly, again, in my opinion, as they could be. And the first step is to start on that conservative side of the spectrum, make sure that everything is in communication, that misalignments are reduced or eliminated, and allow your body to sort of flourish and work the way that God intended. And as long as that's the case, healing can actually begin occurring. And that's a whole lot different than the idea of, geez, I'm just going to simply take medication, alter how my body's ability or how my body can respond to whatever condition is going on, um, simply to sort of satisfy just the symptomatology. Although that can be of big benefit for people who are looking to feel better, ultimately, I'm not necessarily sure that's the best long-term result. And you can look at that from different perspectives as far as side effects from medications, for example, short and long term for that for that perspective. Um, but yeah, I guess me being who I am and my experience within chiropractic, I think the why comes down to being healthy without having to succumb to chronic medication usage, or even potentially surgical interventions, et cetera, et cetera. So yeah, who would benefit? Just about everybody. And I'm sure that we all have folks that we're familiar with, know, love, et cetera, that may or may not have symptoms that they're looking for help with. I kind of think of it as my responsibility to give people the opportunity to um, have a little more information so that they can approach the folks in their circle, and say, geez, I got this guy I know. Maybe it's worth talking to him as it pertains to a more natural approach to uh, improving your health situation or your health status. So, with that in mind, I'll of course open up the wavelengths here, if you will, for any questions, comments, concerns, anything of that nature. You can also type in questions. We have access to that, of course, and we can respond that way, or I can answer them if you just type a question in. And so I'll give just a couple minutes to go, and approach it from that perspective. Um, Other than that, the other thing that I wanted to kind of circle back to is I mentioned earlier I was a patient long before I was a chiropractor, and for some people, I know that you're familiar with me having that experience. The other thing that makes, I guess, my circumstance unique is being able to have such a wide range of experiences and kind of say, geez, this one works really nicely. It's comfortable as a patient, and um, I think that's something that people will appreciate and respond well to, versus others that I've frankly been injured by at different points in time, even as a student, that I probably would not want to do to someone who um, was in the office. The situations where it's not um, no pain, no gain. That is not how, in my opinion, all of chiropractic works. And so, yeah, we want to make sure that risk to benefit ratio, as it were, is skewed more towards the benefit side of things, which I think, again, because of my experience within chiropractic as a patient, I think I've really got a pretty good handle and experience on that. I'm looking. I'm gonna just check and see if we have any questions here. Oops. Oh, okay. All right. If there's no questions, what I'm gonna, I guess, suggest or recommend is, feel free to approach me at an office visit, or if there's any, if you want to send me an email, or if you want to refer or recommend someone to the office, and they have questions, please just, refer them to me, and again, share my email address with them, give them my phone number, et cetera, and I'm happy to discuss, anybody's circumstance one-on-one with them. So, with that in mind, trying to be timely with this thing and not take up too much of anybody's time. If there are no questions, I'll let y'all be, and appreciate y'all, for showing up here today. With that in mind, have a wonderful day, week, month, year, etc. And yeah, I'll catch up with you next week, or I'm sorry, next month, the first Tuesday of the month. All right, perfect. Thank you very much.